Hi again, this is Jim Rush, and I'm going to put a couple of videos up today on YouTube, and we're going to talk in specific terms about the emergency operation plan that we had discussed in the prior video. But now we're going to get into the meat and potatoes, as I call it, of your emergency operations plan. Before I start, there's an awful lot of training that has gone on for the last, since 2002 in emergency management. And I was having a conversation with a friend of mine just a few weeks ago now, I guess. And I was asking about the people who are retiring. Are they sharing information with the next generation of emergency managers or supply chain managers or incident commanders, those types of things? And the answer I got wasn't real helpful. And that's an important message to keep as you come into the field for the new generation of emergency managers and other healthcare leaders, that sometimes the reason why information and skills aren't transferred is because they were lacking there in the first place. So just figured I'd share that with you. So this is the Annex for Hospital Command Center. The HCC, or the Hospital Command Center, is your command, control, and communications hub for the hospital. The Annex identifies the positions of those staffing the HCCs, and here we go, the alternates. So the people who are going to fill in for each position in the Hospital Command Center have to be trained also, and have to have the knowledge transferred from his or her boss down to them, so that when the boss is no longer there, when they retire or when they're on vacation, if they need to activate the Hospital Command Center, they can do so pretty good with good results. So one of the things I want to talk about is the communications systems. I was with the National Bioterrorism Hospital Preparedness Program way back in 2006. And we talked extensively, and of course the grant language that my boss put forth mandated that if you're going to be a grantee, or you're going to be a person who was awarded a grant or an entity, you needed to have communication systems that were redundant, which means no matter what goes on, no matter how bad the disaster is, you can still communicate with the outside world. It's that simple. And so you talk about landlines, voice over IP, which is your internet phones, your satellite phone. They went into, we ended up funding a whole bunch of 800 megahertz digital systems. We talked about the ham radio network and having someone in your community, or several people in your community, who could communicate for you via ham radio. And we talked about internal communication systems, which would be the overhead system that we have in hospitals, nurse call systems, walkie-talkies, and even bullhorns or other communications gear to communicate with people both in the hospital and at the different places where you're doing public affairs announcements. When there's a good treatment of the hospital incident command system. It's on the web, and so there's a lot of good information out there will help you. But the thing to remember, though, is you have all these positions: incident commander, public information officer, safety officer, and then you have your section chiefs. You have your operations section chief, your planning section chief, your logistics, and your financial chiefs. All of those folks have got to have a good understanding of the National Incident Management System, and they have to. We have to have each of their duties spelled out in the annex of the hospital command system. Hospital command center. In that HCC annex, you need to list succession plans. Who is your alternate for each of those section chiefs? The annex should describe the duties of each person in that HCC. When it goes live, how it goes live, who opens the HCC, and who's going to close it, who's going to be the recorder of all the happenings in that disaster. You need to have the various parts of the disaster, communications with the jurisdiction, with other hospitals, maybe in your coalition. Those things have to be recorded, and at the end, you have to have a period. You have to have a point where you wind down the disaster and basically go back to normal healthcare activities. You need to also talk about how the hospital command center communicates, interfaces with the jurisdiction's emergency operations center and basically an understanding of how it works with the state and federal agencies, you'll also have some training in the National Response Framework. It used to be called the National Response Plan. It's now the framework. Anyway, you need to be able to have in the annex how the hospital is going to communicate with the coalition, if there is a coalition of healthcare organizations, and basically the people in the hospital command center need to be well trained and easily identified with the color-coded vest. And all hospital leaders across the board have to have a basic understanding of the National Incident Management System. One of the things that, while we're here, in case you get whether it be Joint Commission or some other accreditation organization, the people in the hospital, the rank and file, if you will, everyone needs to know what the basic goal of the hospital is, and it can be something very simple, like we're planning, we're organizing, we're training, and we're exercising plans so that we can remain open and available to our community and to our patients in a disaster. Something along those lines. It's a 30,000 foot operation goal type of thing for your hospital, because the surveyors, I know, want to know a couple things. They want to know that that people have a basic understanding of what they're going to do in a disaster, how they're going to respond in a disaster, what teams they're associated with. We'll talk later about the human resources annex and how people get appointed to their various teams. And so the people should have a basic overall mission statement and have a good understanding of what they do in a disaster for the surveyors, and that should be fine. Now, back to the National Incident Management System. The emergency manager needs specialized training, and they have that via in-residence trainings with FEMA, and also they have online National Incident Management System, ICS is Incident Command System. They have the 100 series, which is hospital healthcare. You have the 200, which is ICS, or Incident Command System for hospitals. 700 is the introduction to the National Incident Management System, and 800 is the National Response Framework, introduction to that. Additional community training addressing facility implementation training needs to occur, and the hospital providers. Oh, by the way, this other thing I think about often is, if you're a new emergency manager, know that the business of that hospital is taking care of patients, and you're going to see it, and as you talk to the various leaders throughout the hospital, the emergency manager can become overzealous and basically give an impression that emergency management is all important and nothing else matters. And that'll get you into trouble. You need to understand and respect that the business of healthcare is taking care of patients, and the people that you're going to be supporting will work with you, no question about that. They want to be totally informed about how to respond in disasters. They'll give you their attention and they'll give you their cooperation, but you got to remember they have a full-time job. And so anyway, that's pretty much the wrap up on the Hospital Command Center, and the next presentation will be for Plant Operations Annex. Thank you very much for tuning in, and I hope that you push the subscribe button down there. I'm new to this, by the way, if you haven't figured that out already. But if you push the subscribe button, you'll be able to see all the presentations as I put them up. Thank you so much, and thanks again for tuning in.